Hello, I'm Dr. Shurov, neuroscientist and nutrition and health coach. As a part of our new STAR project, which stands for Support Team for Autism Recovery, I would like to welcome you to a new series of interviews with the professionals who are actively working with the children with autism with a great success. They're using techniques and methods based on latest research and science. I'm sure this can be very interesting for parents who are looking actively for a solution and would like to maximize their children's potential in their life. Today I'm going to meet with Laurie Gaudimier. She is practicing neurofeedback technique in Geneva. Neurofeedback is very interesting method which is based on the latest understanding of our brain. And this technique allows to teach our brain to work in much more balanced way, to be much more active, and as a result, children feel much better, concentrate and focus much better, and they also learn how to manage their stress in a much more effective way. I'm really looking forward to this interview, and I'm sure you probably also. Let's begin. Hello, I'm Dr. Shurov, neuroscientist, nutrition and health coach, and also autism recovery coach. And I've got a very interesting guest today. I've got pleasure to talk and introduce to you. So it's Laurie Gaudimier, very interesting person I met in Geneva, and she's a fascinating scientist and researcher, and also very passionate about helping people, and especially children with some special needs. Laurie is studied all her life, as I believe, and she had some degree in immunology back in 2005, and then she had a PhD in biomedical sciences, and then she focused especially in neuroscience research and studied neurofeedback techniques. But what is also fascinating, she's very passionate about nutrition and yoga, and she designing the program and accumulating all her knowledge and techniques in order to help our children. So let's, without further introduction, jump and find out from Laurie how she exactly doing it and why, and how she can help especially children with autism and any other special needs. Over to you, Laurie.
Okay, thanks for this beautiful introduction. So what I'm gonna explain you briefly to you is neurofeedback. So neurofeedback is a method to deal with stress somehow, stress and with our brain waves in more general. The idea is that we can make evaluation of the brain using EEG, so the normal EEG, the same one we have in the hospital, and measure different area of the brain for children, for an adult, and by measuring this different area of the brain, we can have an idea of the attention of the person, of the stress of the person, of concentration, cognitive processes, anxiety. So it's all in our brain.
Yes,
we can measure
exactly.
all that. and so measuring is very easy. I mean, of course, we have the head on top, and we can exactly. So this through the skull. This is the principle of EEG. We just like paste those little sensors, which are exactly the same as the scope we use for heart monitoring. And the evaluation is very quick. It takes about 10-15 minutes. The longest is to take the measurement to put the electrode on the right place. Yeah. And based on that, we're gonna have like a snapshot of the brain functioning of the children, of the adult, of whoever is coming for the biofeedback. And based on this first evaluation, on the result of this first evaluation, we're gonna know which area of the brain we should train to help. So let's say it's a children with attention deficit, the front part of the brain will have a tendency to work slower. So then we will place the electrode at the training session, we will paste that on the area of the brain which is slower. We're going to set a threshold, and the children is just going to sit on this beautiful chair, relax on the chair, watch a movie which he likes, cartoons or space rocket, whatever he likes. and the threshold will make that every time he works too slow, which is his natural tendency, the movie is going to block. And the principle is that the brain doesn't like when there is like a block in music, a block in movie, the brain doesn't like emptiness. So it's going to try anything first by trial and error. It's going to try anything to
stimulate,
to push this signal down, so to stimulate and to increase the functioning of this area. And from session to session, the brain will recognize the task that it has to do, and it will move this threshold. I mean, it will go over this threshold, and not only the children are going to be able to watch the movie in continuity, but the brain is going to practice exactly as you're going to practice a muscle in the gym room.
Yes, so basically learning or teaching our brain to behave in a certain way in a controlled fashion, which is helping really normalizing the functions in the brain, and of course in the body is a following step.
Yes, exactly. And this is done so with this machine that we're using, which is only an amplificator, that we just measure the electricity that is in the brain. We use also this machine to practice biofeedback, and through biofeedback we're going to work specifically on the heart rate variability and different strategies to help the body find calm, find control as well. And it's known as a coherence cardiaque in French, or heart rate variability training. And that's something that we also can do with children. So the same thing, they watch on the screen, they watch their breath moving, and they can experiment with that. This is what is great about biofeedback, is like having a mirror onto our own physiology and see how we can act on that.
Yeah, that's very powerful. I think basically what we all missing, and our children with special needs especially, it's control over our body and mind, and what we're learning when we relax, we can achieve much more. And we can focus much more. And the children with autism especially, they got lots of sensory issues, so their system overload, and their threshold for the noise and every signal basically coming from outside their world, from external world, really bothering them so much.
Because they receive it higher.
Exactly. So to clear this noise around and really teaching them to take control, so it can be very, very powerful.
Yes, and then we mix that with different games. So as you said, I'm very much into yoga, and so I teach yoga to children for I think 5 or 6 years now, and I practice also mindfulness with children. And mindfulness is something which I'm using on a regular basis to each of our sessions. So we do a bit of neurofeedback training with the movie, we do a bit of breathing, and we also do a bit of games around mindfulness, around feeling, around concentration.
So it can be fun at the same time, but also training your brain, training your body to relax, to be present more. And how quickly the children start to sort of get some positive results. Obviously you probably see it on your screen much faster, but the clients, the patients themselves, how quickly they see the difference and feel it?
So what we would start to see the most rapidly, especially with children, is a change in their emotional reaction, impulsivity. And this would be after 4 sessions or maybe 4 or 5 sessions. There would be a bit of feeling of change, it's like very tiny changes that accumulate one on top of the other, and then we see the big result later on.
Of course.
Very first, I mean, there's like, and also with adults actually, we have the feeling after very few sessions that we get less pushed, pushed on our button. We are more controlled, and this is the same with children. They have like different reaction. Most often is the teacher at school that say like there's something that's changed, or it's more okay with children. There's less of this quick emotional triggering.
Sure. More control and sort of more control over your body and your brain is giving you self-confidence, isn't it?
But what is interesting is that at first it would be even like a non-control reaction. It would be a first reaction, manifestation of the change in the physiology. It's not directly cognitively processed by the children or the patient, But then after, when the person starts to understand that through breathing differently, he can control that, then the two together make now the big results.
Difference.
Yes.
Wow, this is very powerful and it's very interesting. And I presume not only children with the special needs and like autism can really benefit from it, but also we know the parents who are very tired, overwhelmed, stretched, you know, chronically tired, will probably benefit from this amazing technique as well, because as we know, we try to deal and with lots of problems, and we try our children be healthy, but if parents not you know, can control their own stress, it's very difficult to demonstrate that kind of calmness around and happiness around. And this is where it's very important. And I always say, you know, if you want to help your child, you need to start from yourself, working on your mind, from, you know, on your perception, what can we change and what we can't change. And I think, you know, this could be very good, you know, first stop in this beautiful room and this cabinet to practice something like that in order to take control of your mind, your body, and then manifest it to your child, to your family as well. And that's very, very interesting as well. So I think it's very powerful. So do you have some children with the special needs as clients, and what kind of spectrum of, you know, conditions you're dealing with?
So I work mostly with attention deficit, children with attention deficit, with excellent results and pretty quick, as I said. I've been working a little bit with autistic children, but as we said, we need to have a proper connection.
Yes, sure. So with a high functional autism, probably it would be ideal.
Yes, this would be ideal for, and then the children has to be willing to sit down here and watch a movie and stay with the movie, and then of course there's like games, and I use also different approaches, through sensory motor approaches.
They need to have some kind of little bit attention to start with.
Exactly.
You can improve and work on dramatically afterwards.
Yeah, but already at the level of the stress management.
Yeah, that's also very powerful. So basically you're using very different technique. Every session is very different. It's not boring. It's very engaging. It's very motivating for children. It's like come on a playground.
Exactly.
And having lots of fun without any disturbance, and at the same time it's very therapeutic and under control.
Yeah. And that's what we want. I mean, we want them to have some dopamine response, so we want them to have like this reward mechanism to get ongoing, so that they support themselves, their own.
This is a proper dopamine response rather than going and have a nice sweet cookie instead.
Exactly.
Oh, brilliant. Well, I think this is a short but very informative introduction to this beautiful technique. And if you would like to learn more about what Laurie is doing and talk to her, ask her questions, you always can find more information on her website. And we're going to post the link to the website and any additional information Laurie will provide us. Then you can learn and find out more, and hopefully to come and talk to her in person, have an evaluation, and see how this beautiful, powerful, modern technique can help you, your family, and your beautiful children can maximize their potential in their life with the help around. Thank you very much.
Thank you.